There can be no health without mental health.
The care of the patient who has mental illness and the person and their family and the system, it's like a puzzle. And our organization is taking a leadership role in acting to rearrange all these different pieces to create an aligned system to provide the best possible internationally leading care.
Your support, your piece of the puzzle, will get us there sooner.
1 in 5 Canadians deal with mental health issues, and 70% of those will have their first episode as an adolescent.
And so we have this huge burden of disease, but because of stigma and the way the system is organized, there's an inability for people to actually access the life-saving care that's there.
A new kind of healthcare for Trillium Health Partners involves new models of care, it involves care at the right place at the right time, and it involves innovation and research.
Well, the concept of right care, right time, and right place is a very important concept. It's nowhere more important than in our young people, because most major mental health illnesses begin in late adolescence. If we don't understand that and address that problem early on, our young people have a much harder time navigating the course of the rest of their lives.
I went home from school one day and decided that I didn't want to live anymore. I didn't want to be here. I was done. So I ran out the front door and I headed towards the train tracks by my house. And the only thing that stopped me that day was my little brother ran out and he held me back and he was crying and he said, "I don't want you to leave and I don't want you to go. And I've already lost so many people. I don't want to lose my big brother." I've used the crisis center quite a few times, and I was working with the crisis workers. She talked me through it, and she made me realize that I'm not a bad person for feeling the way that I feel.
The RBC mental health program for our young people is a perfect example of care at the right time. Not only does it provide care during crises, but it also provides an opportunity to respond within 72 hours to the needs of the patient.
There is a big stigma out right now, that it's not okay to be sick this way. And the truth of the matter is, it's okay. It's just like anything else. It's just like having the flu. You go in, you get your treatment, and you get better. And people need to start talking about it.
At Trillium Health Partners, our mental health services are a key priority in this hospital. We're part of a network of care with our community agencies.
Peel Regional Police have mental health coordinators throughout the organization, and the coordinators meet quarterly with the Trillium Health Partners to identify strategies and solutions to better transition people who are suffering from mental health issues into the hospital system. Police are responding to people who are in crisis. I think the average would probably be 9 or 10 calls a day. And when police are apprehending them, it puts a stigma on the person who is suffering from mental health illness.
Your investment in mental health will help support important priorities such as a new specialized mental health care zone within the emergency department at the Credit Valley Hospital, one that's very similar to the recently opened at the Mississauga Hospital. This space provides our patients with access to crisis services and psychiatric consultation 24 hours per day and ensures they receive immediate and comprehensive emergency psychiatric assessment in a very safe and secure environment.
The Seniors Outpatient Mental Health Clinic is a perfect example of care in the right place. The senior population have a very unique kind of mental health concern because they often also have a co-occurring medical illness. And Trillium Health Partners is taking a leadership role in integrating mental health into medicine and providing a full breadth and understanding of mental health in this way.
We've entered into a medical psychiatry alliance with Sick Kids, CAMH, and the University of Toronto. It's all about a new kind of healthcare, and it brings the mind and the body together. We need services in and outside of the hospital to be able to support our community when their medical and psychiatric needs intersect. The Medical Psychiatry Alliance allows us to do this.
By investing in this groundbreaking alliance, the first of its kind in healthcare, donors can truly be part of creating a transformational model of care that will set the stage for other hospitals across the province and even across the country.
A community takes care of each other, and I'm proud to be a part of this community with its long and rich history of supporting its hospital. I'm also very proud of a member of our community that has stepped forward and pledged to match all gifts made tonight up to $1 million.
In a puzzle, we need to put pieces together in a logical way in order to arrive at the correct solution. With ongoing support, we can now build on the leading mental health programs at Trillium Health Partners.
Together, we can solve the puzzle.
Together, we can build a healthier community.
Together, we can improve access.
Together, we are solving the mental health puzzle right here, right now.
Together, we can create a new kind of healthcare for a healthier community.
Together, we can help people like me.